Good morning, all. Okay, so last class we saw about postnatal. So we will continue that. I think we have not completed the cesarean section. So for normal delivery, normally like it will take 3 days for them. Uh, Normal delivery will take 3 days, and uh, the cesarean section will take 5 to 7 days. Okay, so now in normal delivery, we will not be considering much about the respiratory system because there won't be any much of issues in the respiratory system. So just breathing exercise is enough in case of normal delivery. And we will be concentrating more on the abdominal, spinal, as well as the pelvic floor. But in case of cesarean section, since they are undergoing a undergoing the surgery under anesthesia, we need to be little careful about the respiratory system. So sometimes they may end up in respiratory complications. So we have to be well aware of it, and we have to take proper precautions to prevent that. So not only that, like in this in the postnatal time, we need to be very careful about DVT because there is more chance of people getting DVT after the delivery. Sometimes like because of the hormonal changes, all the smooth muscles will undergo relaxation, so the lower limb will be relaxed very much, and the blood vessels, everything will be very much relaxed, and this will lead to stagnation of blood or pooling of blood in the lower limb, and sometimes it will lead to DVT. So you need to be a little careful about it because sometimes we may lose the mother immediately after surgery if you don't check properly and make them walk. Especially in cesarean sections, they will not be mobile for 6 to 8 hours. So during that time, there is more chance of thrombosis. And after that 6 to 8 hours, if you are making the person to walk or if you are making the person to do ankle toe movement, they may end up in pulmonary embolism. So you need to be very careful about that. So you need to check whether they have any warmth or redness or pain over the calf region. And if it is there, you have to check with the doctor whether you can proceed with the normal exercises or wait for the further investigation. Okay, so you need to be very, very careful on this. Sometimes we may lose the mother. Sometimes the mother may have some stroke or may have some stroke because of the thrombosis. Okay, so here, so in cesarean section for the exercises, we don't have much changes, only some addition like splinted coughing and other thing. Apart from that, all the 3 days exercises you will be prolonging to 5 days to 7 days. In case of fenestrial incision or transverse incision, the mother will be getting discharged mostly in 5 days, 3 to 5 days. So in case of midline incision, the mother will be getting discharged mostly 5 to 7 days. So according to the hospital, according to the protocol, you have to uh, divide the exercises and teach them. Then do not go for progression of abdominal exercises till the wound is getting healed, especially in case of midline incision. So till the wound is getting healed, do not progress for the graded abdominal exercises. You can just wait for them and slowly progress. And after postnatal time also, we can normally start the aerobic exercises in 1 to 1.5 months in case of normal delivery. But in case of cesarean section, you have to wait for further. So you need to at least wait at least 2 to 3 months before going into the aerobic exercises and other swimming, aerobic exercise, cycling, or any dancing. All those things you need to wait for at least 2 to 3 months. That means till the wound is getting healed internally, till that you have to wait. Sometimes you even some of the activities you have to delay for 6 months. Then only you can prevent some long-term complications like incisional hernia and other thing, because internally the wound has to get healed properly. Okay. So in case of transfer session, the first day will be breathing exercise, splinted coughing technique, and ankle toe movement. So ankle toe movement, you have to check whether they have any DVT symptom. If they don't have, then you can proceed for ankle toe movement. Then for breathing exercise, you can go with normal diaphragmatic breathing exercise, but you can auscultate, and if there is any need for segmental breathing exercise, you can go for segmental breathing exercise. Then splinted coughing is must. So you have to splint the wound. It will be so much painful. So you have to advise them properly to splint the wound and cough and bring out the secretion if they have any. If they don't have any secretion, at least teach them huffing and coughing. So in case of further need, they can do it. Then in the second day, you can go for pelvic tilting exercises in lying, isometric abdomen exercises and isometric back exercises in lying, then pelvic floor exercises in lying, then back head. On the third day, you have to check for the wound healing. If the wound does not heal, then you can give IRR, because IRR is very effective treatment to enhance the wound healing. So if any mild redness or anything, you can go for IRR. So this IRR have to be kept 50 to 70 centimeter perpendicular to the wound. So perpendicular to the wound, you have to keep the IRR lamp for 15 to 20 minutes. This will enhance the wound healing. Then slowly you can start with the abdominal exercises. So you can go for lower abdominal exercises like single leg sliding. So in crook lying, you ask the mother to go for single leg sliding. Then along with isometric abdominal exercises, they can go for single leg sliding. This is called core stabilization exercises. Then back care, then feeding position, napping, changing position, baby bath, all those things. So feeding position, so in case of midline insertion, uh, they may not be able to go for this normal feeding position, but they can do a football feeding position. So football feeding position means, I'll show you the video. Football feeding position means they have to keep the baby in between the trunk and the hand. So in the side, they have to keep the baby and hold the baby's head with one hand towards the breast. Is that clear? So that is called like football feeding position. That will be very much effective because it will not touch the wound. So sometimes when they have to keep the baby very close to the abdomen. When they are keeping very close to the abdomen, the wound might get hurt and it may be painful. So that's why you can teach them football feeding position. That is uh, very useful one. Then on the fourth day, you can go for next stage of abdominal exercises. So like you will be doing isometric abdominal exercises, then single leg sliding. Slowly you can go for progress for grade 2 abdominal exercises. In case of in case if they find it very difficult, they can go for bracing abdominal exercises, but they should not go for trunk rotations. They have to avoid trunk rotation. They can go for normal abdominal exercises. Then posture correction, relaxation position, pelvic tilting in sitting and standing, because on from the day 3 onwards they will be walking little bit. So you can go for pelvic tilting exercises in sitting and standing. Then day 5 is single leg slide and crook lying with abdomen retraction. That means like in crook lying, they have to perform head lift as well as the leg slide both together. So that is in the day 5. Then shoulder bracing exercises. Then you can teach home program, then advanced abdominal exercises, core stabilization exercises, everything. So in home program, you will be teaching advanced abdominal exercises, core stabilization exercises. But if the mother is very keen, and if the mother says that like they will be coming back to you after like during the review time, then you can wait for it and teach them later, because this advanced abdominal exercises they are going to start nearly after 1.5 to 2 months. So sometimes they may forget it, so that's why you can advise them to come back to you later. But in case if they are saying that they will not be able to come back, then you can teach them on the discharge day. So same thing for the midline insertion, but you have to drag little more and you will be doing till 7 days. Okay, so in midline insertion, you need to be very careful that they should not go for head lift until and unless the wound is healed properly. And even if after that, if they are going for head lifts, they have to do abdominal bracing exercises and abdominal bracing exercises only. They should not go for the graded abdominal exercises. Is that clear? Then same wise, if they are confident that they will be coming back to you after 1 month or uh, what I say during the review time, then you can wait for the core stabilization exercises and abdominal exercises and teach them later. Okay. So apart from the normal other postnatal problems, I think last week itself we have seen all these postnatal problems. So according to the problems, you have to teach them the exercises. So painful perineum, you have to teach pelvic floor exercises. Then you can advise them lifestyle modification like sitting on a donut pillow. Then you can give ultrasound using a glove, water glove method. You can give IRR. Then you can give sits bath. Sits bath is nothing but bidets. That is in a basin of warm water. You have to make them sit and do pelvic floor exercises. So this warmth as well as the pelvic floor exercises will increase the circulation and will reduce the pain and enhance the healing. Then for diastasis recti abdominis, teach them bracing abdominal exercises. And if the diastasis recti is severe, then you can go for abdominal binders. So measuring abdominal binders is you need to measure around the umbilicus and add 2 inches. That means around the umbilicus, if it is 38 inches, then you have to buy 40 inches abdominal binder. Okay. Then you can give TENS for low back pain. You can give massage positions like pelvic tilting exercises and posture correction. So emphasize on posture correction more and more because of breastfeeding. Another thing, they will be going for rounded posture like stoop posture. So you need to advise them to avoid that. So you have to emphasize more on posture correction. Then some people will have symphysis pubis dysfunction. So for them, rest and pelvic support. Give them walking aid if the pain is very severe. Teach them isometric adductor exercises. Hydrotherapy will be very good, but in case of cesarean section, don't allow them to go for hydrotherapy. You have to wait. Okay, then you can give ultrasound and ice massage. So thoracic spine pain is because of the posture, because of the breast heaviness, they will be going for rounded posture and they may end up in thoracic spine pain. So teach them good shoulder bracing exercises, good rhomboid strengthening exercises that will help them to reduce the problem. If they have any swelling and if the nerve is getting compressed, give them uh, ice rest with elevation and ultrasound. So for varicose vein, you need to prevent DVT, need to be very, very careful on this because sometimes we may lose the mother because of a simple reason. So you have to check it properly every day and avoid this like thrombosis. So ask them to go for brisk walking, elevation, stockings, and ankle toe movement in case if they have varicose veins. Then hemorrhoids, again pelvic floor exercises, ice, then defecation technique will help you. Then for incontinence, good pelvic floor exercises starting from lying down. Then you can teach them in sitting and standing. Then if the mother has water retention, because of that the whole body will be bloated. So you can advise them to go for walking, do a lot of ankle toe movement and reduce the swelling. Then go for warm bath. So this also will help you to reduce the swelling. Sometimes they may have this breast problems like mastitis, encouragement, and other thing if the baby is not drinking properly. So they have to advise them to let out the milk, whatever is excess, so that you can avoid all these problems. Then sometimes they may have this after pains. After pains means same like delivery pain they will be getting. So you need to avoid this. So sorry, you need to give good psychological counseling that they have already delivered, and still if they have, then you can go for TENS placement over the back. Especially you can place it over the area where you will have first stage of labor pain. So that is T10 to L1 and S2 to S4. Sorry, in the second stage of labor pain. So this will give them a this will give them a sensory stimulation, and this will reduce the after pains. So after pains means same like labor pain they will be getting after the delivery. Okay, then sometimes they may have postnatal emotions and psychiatric problems. Give them good counseling in case if the mother has any disappointment or anything. So definitely the mother will find it very difficult because her body itself will take little longer time to come back to normal in case of cesarean section. So in case of cesarean section, the mother will find it very difficult if like very difficult after 4 or 5 days after they stop the uh, painkillers for cesarean section. Then they will find it very difficult. It will be so painful. So apart from her herself, she has to take care of the baby. So she will be definitely having a psychological changes, and she will not be able to cope up with the additional responsibility. So good psychological counseling, as well as advise them the partner also to support her in all these times. Okay, so this is very very important. So this is the football position where you will be holding the baby in between your trunk and hand. Okay, and this is very good position for cesarean section uh, feeding. Is that clear? Okay, so now we will see the videos related to all these things. So I think last class we have seen about MMT and uh, diastasis recti, right? So after that we didn't see any videos, so I'll show you today.
You might think that all new mothers.
So first is regarding the breastfeeding positions. So you can see, you can ask the mother to sit properly in a chair with good pillow support. Can you see here? Good pillow support. She has to sit properly with hip and knees at 90 degrees and the leg properly supported on the floor. Okay.
You might think that all new mothers will naturally find breastfeeding a walk in the park. But do you know that there are some women who struggle to get their babies to latch properly? In this video, Ms. Helen Cruz, Senior Lactation Consultant, shares with you 5 breastfeeding positions you can try to help find what's best for you and your baby. You might think that all new mothers will naturally find breastfeeding a walk in the park, but do you know that there are some women who struggle to get their babies to latch properly? In this video, Miss Helen Cruz, Senior Lactation Consultant, shares with you 5 breastfeeding positions you can try to help find what's best for you and your baby.
Laid back position. Lie down on a supported reclining position. Mothers should lie on some pillows for back support and not lying flat on their back. Place your baby with his or her tummy down on your belly. This will help to foster skin contact. Allow your baby to find the nipple on his or her own and gently guide your baby if help is needed. There is no right or wrong way to breastfeed in this position, and many mothers figure out their preference rather early. Cradle position. This is one of the easiest and most common breastfeeding positions for mothers and babies. Cradle your baby in your arms on the same side of the breast your child is feeding from. The crook of your arm will act as a pillow for your child's head to rest on as he or she is turned towards you. Support your baby's bottom with your hand. For newborns, their head and bottom should be in line. For older babies, you may lower their bottom down slightly. Support your breast if needed with your free hand. Cross cradle position. This position is similar to the cradle hold but is especially good for small and premature babies. Using your palm, support the back of your child's head and shoulder at the nape of the neck. With your forearm, hold his or her body and bottom firmly. Football position. Similar to the cross cradle hold, use your palm to support your child's head and shoulder at the nape of the neck and bring him or her up to meet the breast. Support your baby's body and bottom with your forearm. Tuck your baby under your arm so that his or her legs are behind you and the head is at your breast. Side lying position. While this is the most difficult position to get down to, it is great for providing mothers with extra rest. Lie on your side with your arm or pillow under your head for support. Your baby should be lying on their side with their mouth near your nipple. Use a rolled up receiving blanket to prevent your baby from rolling away. Alternatively, you can also get your spouse to help you get the baby latched on so that you don't have to move from your position. There is no definite breastfeeding position that all mothers should follow. Use the position that works best for you and your baby for a comfortable and enjoyable nursing experience.
Okay, so you need to emphasize one more thing that after the feeding, they should not immediately make the baby lie down. They have to make the baby burp properly and then only they have to lie down. Okay, so burping, like they have to keep the baby upright over the chest or over the shoulder, and they can slowly touch the back or slowly just give a tapping over the back so that they get the burp. Then maybe it will take 15 to 20 minutes. Sometimes it may take at least half an hour also. So after that they have to make the baby lie down. Okay, so the next is for the abdominal exercises. So exact postnatal video I didn't get. This is for mother who has diastasis recti. Okay.
First, lie down on your back on a non-slip mat. Next, hold your legs touch that your feet are on the floor and your knees are pointing towards the ceiling. Now, fold your arms across your middle over your belly button such that your right hand crosses over to the left and your left crosses over to the right. Now
So
slowly lift your
this
head and
position is
shoulders
called,
off the ground
this
as
is
if you were
like,
performing a half crunch.
this is your bracing abdominal exercises. Okay.
Slowly return to starting position. You can repeat this exercise up to 8 times. As you build your stamina, you can increase the number of repetitions. Diastasis recti is a common condition which women suffer from post-pregnancy. Hormones released during pregnancy soften up the connective tissue between the abdominal muscles. Further, the growing uterus exerts pressure on the tissue and causes it to widen. Although a small amount of widening or separation of ab muscles is normal, excessive separation can lead to problems. Diastasis recti occurs in 30% of all pregnancies. This condition can reduce the strength of the abdominal muscles and cause lower back pain. In case you find that you have this condition, it's best to consult your doctor. Although diastasis recti can make it difficult for you to do abdominal exercises, the good news is this condition is not serious and it heals within the first few weeks post-delivery. Take care and
So for, in case if they have diastasis recti, then like you have to teach this abdominal bracing exercises, then isometric abdominal exercises. This is very, very important. So this is about isometric abdominal exercises.
So our next exercise is an abdominal contraction exercise, focusing on your lower abdominal area, which is called your transverse abdominis muscle. So we'll do an isometric. So first you'll place both fingertips of both hands on your low belly or pelvis bone area. You'll be comfortably relaxed with the knees bent, with very relaxed and normal breathing. So the area of focus is between your fingertips. There are many different cues we use to engage these muscles. One is the idea of gently drawing the muscle inward that's underneath your fingers. Excellent. And it's really important to maintain normal, relaxed breathing. If that felt difficult, some people will consider a small zipper that comes from the crease of their hips towards their fingers or from their fingers inward, gently drawing in, again maintaining normal breathing. You'll try to hold this contraction approximately 10 seconds to ensure relaxed breathing, and you'll try to do this 5 repetitions 2 to 3 times per day. Some of the things that people do in error with this exercise is they actually try to do a pelvic tilt or flattening of the low back, which is not what we want ideally, or they will actually draw air in under their ribs, lifting up and arching their back. Also not what we want. So relax there. And that was great.
So we will be starting with these 2 exercises. Then you can go for graded abdominal exercises. So graded abdominal exercises, I'll show you. One minute. Hello. Good morning. Sir, orange. Orange. Sir.
lie on your back. Your knees should point towards the ceiling and your feet should be flat on the floor. Now, slowly take a deep breath in and place your hands on your thighs. As you exhale, raise your body off the floor and slide your hands up your knees. If you feel comfortable, you can hold this position for 4 counts. Now slowly return to starting position. You can repeat this exercise up to 10 times. The back is one of the areas that can get deeply affected due to pregnancy. The normal curvature of your spine deepens further due to the growing weight of the abdomen, and this can cause backaches in the postpartum period. Before you start this exercise, make sure you are not suffering from diastasis recti, a condition in which the ab muscles widen. Also, if you have had a cesarean section, avoid doing any abdominal exercise for 4 to 6 weeks. As your stamina increases, you can start doing up to 4 sets of this exercise every day. Once you feel comfortable doing this exercise, you can proceed to doing the full crunches as well. Make sure that you don't exercise on an empty stomach. Do have a piece of fruit. Take care of yourself and happy exercising.
Sorry, yeah. Okay, so I'll show you a video of another abdominal exercises, but this one they have not done in a pregnant women, but still they have done a graded abdominal exercises. Okay.
Hi, I'm Margie Weiss. The name of this video is How to Stay Fit Over 50, and this segment that we're doing is the abs, the core. There are a lot of different muscles in the core. Most people know what a crunch is because they've been doing it all their life, but they've probably been doing it wrong all their life. The idea behind working your core, especially your abs in the front, and abs are in the back as well, but is to make sure that the belly button and the lower abs contract downwards as you work. If the muscle can go down or it can go up. And if it goes up, you're going to build a dome in your lower abs. And we don't want to add volume to our abs. We want to get them toned, but we want them as contracted and as small as possible. So anytime you lift into a crunch, whether it's arms or legs, first you want to breathe out, press your belly button to your backbone, and hollow your lower abs. Try to press your lower back into the floor. In order to do that, squeeze your glutes because they're involved too. That way from here to here is all involved in every crunch workout. It's not an exercise for your neck, so doing this up and down is not going to get your abs any stronger. If you do ab work where you're lifting your chest, basic crunch, she would probably have, at first, hands behind the head because that way you're supporting your head. You don't have to if you're strong enough. But if she was doing that, if you put your fist right under the chin, as she lifts, her nose is coming straight up and her space between her chin and her chest is still there. What she doesn't want to do when she comes up is crunch this way because now she's gotten her neck extended, but she hasn't done anything more for her core. So as she comes up, her chin's going straight up, kind of feels like your chin's going to the ceiling. And what happens here, as you'll notice, when she goes down and comes back up again, it's going down and under as her chest lifts. So her belly button's going to the floor. You're going to breathe out on the rise so that you get rid of the volume of your lungs, and then breathe in when you get to the bottom. Every time you come up, you squeeze the glutes as well so that your lower back is on the ground. Now you don't have to have your hands behind your head. If you're a little bit more advanced, you can put your arms right down next to your thighs. And if you want, you can even put a weight in both hands because that way you can generally come up a little bit higher. So you can do that crunch, and because you have a counterweight there, you can get up a little higher. But again, don't make it a neck exercise. It's rib to hip. The rib and the hip bone come together. In order to come together, the belly button has to get out of the way. So it's got to go down as the body comes up and as the rib and the hip come together. So that's a basic crunch, and that's the one that most people know how to do. But it's not the one that most people are weakest in. Most people, especially women, are weak in the lower abs. And since the lower abs keep your intestines and everything else that's in your stomach in place, you want to have them strong enough that they draw upwards and inwards. So the way to do that is to work the lower body. If you get into an L position, your lower back is on the ground and you can feel it. Object on these exercises is don't lower your legs any lower than your lower back can handle. So if it's starting to come off the ground, don't go any lower because you're not gaining strength. You may be injuring yourself. Easiest option, one leg at a time. Legs are going to be bent. So you're just going to tap one leg down and tap the other. Easiest option. Once you've mastered that and you can feel your lower back on the ground, you can do 2 legs at a time. And you can go down a little bit, you can go down a lot. You decide by the determining factor being your lower back, staying on the ground. Once you've gone past that, and it's comfortable and safe, you can do it with straight legs. And again, you can do 1 leg at a time, so you just drop 1 leg down, come back up, and the other leg. Or you can do both legs, concentrating on where your lower back is. Breathing out on the rise, and breathing in as you drop. If that lower back comes off the ground, don't go so low. Or many people can get down with their legs straight, but they can't get back up with their legs straight. So you can go down straight and you can bend them on the rise. So you get down to here and you relieve the pressure a little bit by bending the legs to get back to the top. So you have a kind of a circular motion. It can be done with 1 leg or 2 legs. So that's the lower main ab group. And again, the determining factor is where your lower back is on the ground. You want to press it into the ground. From here, we'll move to the obliques. So all she's going to do is turn on her side. You're going to have bent legs. The top leg is about 4 inches off the other. Your head's going to be on the ground, and you're going to look right up at the ceiling above your body. So you're going to take your hands just like this and look right up at the ceiling, because now you've twisted your body slightly. So you're going to get the muscles that move diagonally across the body. By having your knees slightly apart but your feet together, it allows you to twist a little bit more. And again, you've got some upper and you've got some lower. So the more she can face the ceiling, and some people are more flexible than others, but you want to try to see if you can get both elbows to the ground when you're lying down. And the nose, again, is coming straight up in the air, and she's just lifting it, and you'll notice she's not going very high compared to a regular crunch where you can go higher. The muscle here, again, the rib to the hip bone, and you're squeezing your glutes at your rear end nice and tightly so that you're stabilizing the lower body as you lift the upper body, and you're getting the diagonal across here. If we want to work the lower aspect only, she relaxes her head, and you got choices. Easiest choice, just lift 1 leg up in the air, about 1 inch or so, drop it back down. Yep. And then if you're a little bit better and you want to add something to it, try to lift both legs off the ground. They don't have to come high. They can stay low or they can come much higher. You decide. You breathe out on the rise and you breathe in on the drop. Once we've done the obliques and the main muscles, if we sit up, we can add a lot of back work in at the same time as we're doing front work.
To watch the other segments in this video series, or for how-to videos on almost any other topic, visit monkeyseed.com.
So, sometimes this advanced abdominal exercises, you may not be able to teach them. So you need to keep in mind, abdominal exercises depends on how much the mother is able to do. According to that, you have to progress. Most of the time, they will not be able to do the graded abdominal exercises initially. So they might take little longer time to do it. Okay, so don't force them to start the exercises. It may take some time for many of the people. Okay. So next is regarding the Kegel's exercise.
Do you think this exercise will strengthen your pelvic floor? Unfortunately, the answer is no. While this exercise is really great for strengthening your buttock muscles, it won't strengthen your pelvic floor, and it'll just really waste your time if that's why you're doing it. Now today, I'm going to guide you step by step through Kegel exercises that won't waste your time and will strengthen your pelvic floor. This guide is suitable for you if you're a beginner starting out, or if you're a little unsure about doing your Kegels. Now today we're going to cover the best Kegels position to start with, and then we'll go through how to do your Kegels step by step. We'll take a look at how many Kegels to start with, and also how long you need to wait for results. So when you're starting out, the best position for doing your Kegels is the one that you can really feel your exercises. It's often really quite hard to feel your Kegels, so getting yourself in the right position can really help you when you're starting out.
So you might like to try your exercises in any of the following positions and see which one works best for you. So you can try perhaps kneeling on all fours, lying prone on your tummy, lying on your back, on your side with a pillow between your knees, or sitting, which is the position we're going to start with today. Now let's get started with your exercises. Your pelvic floor muscles are here, between your legs, where you sit. Now looking at the same view on this model, you can see how the pelvic floor muscles wrap around the three openings in your pelvic floor. You can see them here at the front, around the urethra and the vagina, and you can also see them here circling around the anus at the back. We're going to be exercising all these muscles together now. Now, here are the 3 steps for doing your Kegel exercises correctly. I'll guide you carefully through each step, and then we'll put all the 3 steps together. I want you to start by moving forward away from the back of the chair that you're sitting on now. I'd like you to lift your chest and keep the inward curve in your lower back like this. So you're sitting tall here, your chest is lifted like this, and you have an inward curve in your lower back. Now here's the first step. Try to tighten your anus like this, as if you're stopping gas from passing. You should feel your anus tighten, but your buttocks should stay relaxed. So try that now. Try to tighten the anus, squeeze shut. But if you notice that you're moving up and down like this, you're using your buttocks, and that's not the right thing to do. Try to keep them relaxed, because that can make you actually think that you're doing the exercise when you're not. Now try again, tighten your anus and try to lift it inwards as if you're lifting it upwards towards your navel, as well as squeezing it shut. You should feel a squeezing and lifting sensation around your anus. Now relax around that area and back to resting. How did you go with that? Hopefully you could feel a tightening sensation, and this is part of your Kegel exercise. Now, step 2 can be a little tricky, so I need you to listen really carefully. I want you to tighten and squeeze the entrance to your vagina as if you're closing it shut. All right, let's try that. Try to tighten around the vagina, but also try to lift it inwards, as if there's a string drawing up from the top of your vagina up inside towards your navel. Okay, so see if you can draw that up and in, and you might feel your anus tighten and your lower belly tighten too. That's exactly what you want to happen. Now relax back down to resting. So if you're having trouble feeling this exercise, try rolling up a hand towel and sitting on it like this. This can make it much easier to feel your Kegel exercises. Now step 3. Here's your final step, so stay with me, we're nearly there. This time, try to tighten, or imagine you're tightening the area in front of your vagina where your urine comes out. Imagine that you're stopping or slowing the flow of urine. Can you tighten this area? This can be a little difficult to feel, especially at first. You might also feel your anus and vagina tightening too, and if you can, that's great. Now relax back down to resting, take a nice deep breath in and out. And now let's combine all 3 steps together. This is a correct Kegel exercise. Start by sitting tall, breathe normally. Now tighten your anus and vagina and lift them both inwards and upwards inside towards your navel. Now at the same time, try to squeeze as if you're stopping the flow of urine at the front. Do these actions all together, all at the same time, and now relax back down to resting. Take a deep breath in and out. How did you go with that Kegel exercise? Could you feel your pelvic floor muscles contracting? If you're a beginner, try not to be too hard on yourself, because Kegels can be really hard to feel, especially when you're starting out. But once you can feel the muscle tightening, you'll be well on your way to strengthening your pelvic floor. Let me know below if you have any questions about how to feel these exercises. I'd really like to know. Now, how can you know if you're doing this exercise correctly when you're starting out? Well, there's a couple of ways, and these are quick, easy ways you can try at home. You can try to stop or slow the flow of urine, but just do this once a week and just as a test, not as a regular exercise. You can also test some of these muscles by tightening to stop passing gas when you feel the urge to pass gas. The video linked above helps you to feel your Kegels, so you may like to watch that exercise too if you're still unsure about how to do your Kegel exercises technique. How many Kegels should you start out with? Well, when you're starting, start the first couple of days just doing 1 or 2 gentle Kegel exercises in a row and really try to focus getting your technique correct. This is the most important thing you can do at first. Then, as your technique improves, you might be able to do a few more Kegels and you might be able to hold those exercises for a little bit longer if you can. Try not to worry about doing strong exercises just yet. Technique is far more important. You may like to subscribe below to catch my Kegel strength training video that's coming up in the next few weeks. Now, if you can do 2 Kegel exercises in a row for 3 seconds, that's the number of exercises you start with. 2 exercises in a row and holding each exercise for 3 seconds. Try to repeat this routine 3 times a day. Ultimately, you're working towards doing your Kegels following this recipe. 8 to 10 exercises, up to 10 seconds for each exercise, and resting for about 6 to 10 seconds between each exercise. And you try to do that exercise routine 2 to 3 times a day on most days of the week. Now, some women will notice improvements within the first couple of weeks of starting their exercises, while other women will find it can take 5 to 6 months to actually get full strength gains, particularly if starting out with weak pelvic floor muscles. Thank you for watching today. I really hope this guide helps you get started. A lot more confident about doing your Kegel exercises. Now, don't forget to give this video the thumbs up below if you found it helpful and subscribe to my upcoming Kegel strength training video. I'll see you next time. Goodbye for now.
Next is again the core stabilization exercises.
This workout is perfect for everybody, but it is also so helpful for after pregnancy for core stabilization and realigning everything after you've been front loaded for so long. We're going to start.
So as a physio, you need to keep in mind that initially we need to concentrate in abdomen, but later you need to concentrate on the core because we need to strengthen both the spinal extensors as well as flexors. And in flexors, we have around 4 muscles. So all the muscles are like very much, all the muscles need to be strengthened to obtain a proper abdominal strength. Is that clear? So you need to concentrate on the core muscles, core stabilization technique as they progress to the final stage. Okay. So initially you will be going with abdominal exercises like graded abdominal exercises. Then later at the end, you need to go for the core stabilization exercises.
Off, we're going to be doing sets of 10 of everything, but first we're going to start off getting the core a little bit warm, and all I want you to do is place a hand on your belly, and as you inhale, then exhale, I want you to think about flattening your belly. So inhale, exhale, flatten your belly. Inhale, exhale, flatten your belly. 2 more, inhale, exhale, tighten that transverse abdominis. That's the deep innermost core muscle. Inhale, and tighten and pull down here. Okay, so stay down here. Keep that transverse abdominis, the innermost muscle, contracted by pushing your back down, belly down. And what we're gonna do is pelvic tilt, nice and slow. With a pelvic tilt, all I want you to think about is hips coming to rib cage. So go ahead and lay your head down. Your TA, your transverse abdominis, pulled in and down, and we're gonna go 1, 2, 3, and release, 2, 3. Bring it in. You can barely see the move because it is so small, nice and slow, but just think about bringing the hips to the rib cage. 1, 2, 3, and 1, 2, 3. Just enough to contract that inner core as well as the pelvic floor and pull it up. Going for a set of 10. Halfway there. And if you find that you're tightening your glutes, your cheeks as you do this exercise, what you can do is you can open your legs as you do this and release. You'll notice you don't use your cheeks as much because I want this all stemming from the core, nothing from back here. This should be nice, loosey-goosey, and jiggly right now. So you can do it from this butterfly position or back up where our knees were up. We got 3 more slow pelvic tilts. We're doing a total of 8 exercises. And 1 more, and this time hold the pelvic tilt. Hold the pelvic tilt. Now, you've got the tilt, you've got the transverse abdominis where your belly button is pulled in, down, and flat. And I want you to go arms up, down, around, down. And as you do this, so it's up, down, you'll notice my core is staying stationary. I've got the tilt, and my belly button is pulled in and down. Now, if you move or arch your back, you've lost the positioning that we're going for. Up, down, around, down, halfway there. So everything stays nice and solid, keeping that lower back on the ground, pelvic tilt, belly button is pulled in and down, no arching as you move the arms. Last 3. So no arching, keeping that pelvic tilt in, TA is down. Last 1. All right, keep the arms down. Still keeping that pelvic tilt. Transverse is engaged by belly button pulling down. And now we're going to march your legs. And I want you to think about coming to a 90-degree angle right here, not past it. And we're going to march. So it's just here and release. And as you do this, notice the core stays stable and stationary. And inner core is the only thing working here. Your TA and your pelvic floor. Just nice and slow. Let's do 4 more. 3 more, then I'm going to make this march a little bit harder. 2 and 1. Now I want you to place your arms overhead just as we did prior to this, and still keeping that pelvic tilt, belly button pulled down, keeping your arms over your head. Now I want you to march, keeping everything nice and stable. Makes it a little bit more difficult for sure. Now you'll notice this is very different from traditional core training, and that's because we've got to get that inner core. Last 1. All right, now bring the arms down, and we're going to come into what I call the 90 zone. So bring 1 leg up at a time. And now that also made it easier to keep your back flat, but keep your knees at 90. I don't want them to come in or come out. Keep them right at 90. Belly button pulled down, kind of a little pelvic tilt here. And now what I want you to do is take this into a reverse march. Only as far as you feel you can, which might not be touching those toes all the way to the ground. Because I don't want you to necessarily engage the rectus, which is your outer muscle. I just want you to pull that belly button in. All right, here's 4 more. 4, 3, 2, and 1. Okay, go ahead and release. I want you to do a 1-leg scoop. So again, pelvic tilt, TA's pulled in and down, and you're going to take 1 leg and you're going to flex it as you scoot the heel all the way out, all the way till that heel's totally flexed, and bring it in. Switch sides. So flex that foot all the way out, bring it in, and again, keeping that core stationary. as you do this. All the way through a flexed foot. Get back in. Couple more. Now you want to make sure your shoulders are down on the ground, because the minute you do this, you're putting extra pressure on that connective tissue in your abdominals. That's why our lower back is down and upper back is down. You don't want to put any added pressure. And done. Okay, on to our 8th and final exercise. What I want you to do is just lie on your belly. We're going to alternate lifting one arm and one leg. Here's 10, 9, 8, 7, 6, keeping the arms and legs straight. Last 2. And last one. Okay, and that does it for core number 1 workout. Now, I want you to make sure you just don't do this workout and run off and start doing core plank jacks or any crazy core stuff. And if you've mastered this workout, you can then move on to core 2, core 3, core 4, and core 5, because we progressively add in core strength where we use the rectus and the obliques and all that stuff. We're not just gonna all of a sudden throw some crazy stuff at you, because that could kind of undo all the health and integrity that we just built. So I want you to slowly progress in your core progression, and I promise you will get that core back.
So, like I have added few more videos about the abdominal exercises and core stabilization. So apart from that, we'll just move into breathing exercise and splinted coughing technique. We'll just see one more core stabilization exercises, okay?
All right, guys, so today we're going to talk about the 3 core stability exercises you should do every day. Now, if you've heard that one word in that phrase, I'll talk to you guys about the 3. All right, guys, so today we're going to talk about the 3 core stability exercises you should do every day. Get up and get down, get up and get. Now, if you heard that one word in that phrase, it was stability. I'm not going to be talking to you guys about the 3 dynamic core exercises to work your abs. This is a stability video, meaning the emphasis is on limiting excessive or unwanted motion at our spine so that we can have awesome carryover to the exercises that we're looking to perform in the gym, like your squat, your deadlift, your bench, your clean, and snatch. If you do these exercises, I promise you, you will feel much more powerful in each one of those movements. So let's talk about what the exercise grouping is called, the McGill Big 3. Now, these are based off of the research from renowned back expert Dr. Stuart McGill. Now, Dr. McGill has spent his entire life working on how to stabilize the spine and understand how the way in which we use our spine leads to certain types of injuries. Now, whenever we're trying to keep our spine resilient to injury, under load, we want to brace it, lock it into place, and then move about our hips. So the different exercises that we do today, starting off with the curl up, are going to emphasize that. Now, when a lot of people work the front of their core, what do? They do crunches. They move their spine. Look at my spine right now. It is flexing up and back down. Now, while that's not a bad exercise at working the front of your core through movement to strengthen your rectus abdominis or six-pack muscles, I want to emphasize stability. I want to limit any motion at my spine. So what am I going to do? Drop one foot. Now, if you're not in pain, doesn't matter which one. You're going to have your hands underneath your low back. Now, these hands are pressure sensors. They're going to pick up if you round your back. So keep your hands here to feel for whether or not that happens. What you're going to do is brace your core. You're going to turn all those muscles on, and then you're going to pick your head up just slightly off the floor and hold for 10 seconds. The hold is the most important part of this. We're not just moving our spine. We're trying to emphasize stability by getting those muscles to kick on and lock the spine in place. So this is what it's going to look like. Brace, pick the head up slightly. Hold for 10 seconds. 3, 4, 5, 6, 7, 8, 9, 10. And then back down. Now, if you're feeling your neck is a little turned on and maybe just a little bit stiff while you're doing this, all you're gonna do is tuck your chin first. So just tuck your chin a little bit and then pick up. And that may help a lot as far as taking some tension off the front of your neck. But again, this is a slight pickup of the head. What I don't want to see is this. Don't pick your head up this high. All you have to do is pick it up slightly. And by holding it here and keeping your core braced, all these muscles on the front side of your spine, like your rectus abdominis, your transverse abdominis, all those muscles are turning on really, really hard to basically stiffen the spine. Now, back down, something like this, do 6 reps in a row, and I promise you, you'll feel those muscles working. Now, what does that exercise do? Like I said, it's working the front of our spine. There is no one-size-fits-all when it comes to hitting all the parts of your spine because there's a lot of muscles that make up the core. So we need a different barrage of exercises to really hit all parts. Now, the next one let's do, how do we hit the side? Side plank. Now, you're gonna get down on your side from your elbows. Now, the modified version is usually one of the most easy go-to exercises. You're just gonna pick up and hold in this position. Now, this is a great exercise for hitting that downside part of your core and your lateral hip, your glute medius. So if you have a very weak or poorly coordinated glute medius, lateral hip muscles, you'll feel this working there too. Again, 10 seconds and then back down. Something like this, 6 reps on each side. Now, if this is really easy, how do you modify it? Let's go to a full plank. From here, when you put our hands here, this is step 1. If that's too easy, put your hands here. Again, we're holding for 10 seconds. We're turning on those muscles of the spine. We're limiting excessive unwanted motion. I want that spine here, and I don't want to twist. We're limiting excessive or unwanted motion of the spine and stabilizing and locking it in place. So again, 6 reps each side, 10 seconds. Now, we're going to go to the last part. We've hit the front. We've hit the sides. Let's hit the back. Now, when most people think, how do I work the back? What do? They're trying to work back extensions, Supermans, things like that. You're moving your spine into an overarch, into extension. What do we want to do? We want to limit excessive or unwanted motion of the spine, lock it in place in a neutral position, and stabilize around that. The bird dog is a great exercise for that. Very low load on the spine, but working those muscles, the erectors of your spine, very well. This is what you're going to do. Get on all fours. Now again, find that neutral position. So you're not rounded, you're not overarched. Find that middle position from right here. You're going to brace your core, and you're going to go opposites. So we're going to go right hand extension, left leg kick out. We're going to go out, and we're going to hold it for 10 full seconds. Now, after that 10 seconds, keep the spine braced. This is the part where a lot of people mess up on, is we're going to slowly come back, not move your spine, touch, back out. Hold for another 10 seconds. We're sweeping under our body. If you think about this, what's happening at my hips? Flexion and then back. This is like a squat as far as the motion that's occurring. Back flat, no motion at the hips. I don't want this because what just happened? I lost my neutral spine in my back. So as you go out, you're keeping that core braced. Hold for 10 seconds, sweep back under the body, touch, and then back out. Now, common mistakes that I see with this exercise. First, kick the leg way too high. Now, watch my back while this happens. I'll just do the leg movement, but people do this. What happened to my back? It overarched. It extended. I want that foot only a couple inches off the ground. Watch the difference. Overarch. I'm going to keep it just a couple inches off the ground. Do you see the difference? So we're able to keep that core in a little bit better position because we're keeping our hips moving as they should because the hips directly affect the spine. Next thing, I want you to think about really making a fist as hard as you can with your arm. And when you do that, you're going to light up some of those muscles of your upper back as well. If you do the bird dog correctly and create as much tension from fist to foot, this is going to be tough. You should be sweating by the time you're done with this. So watch how I do that with a lot of emphasis also in my fist making a lot of tension. So we're here, brace, fist, out. 4, 5, 6, 7, 8, 9, 10. Under, tap, back out. And again, 10 seconds. Now, if that is too tough for you and you're wobbling all over, how do you regress? You can do that with only the hips. So just be here and just extend the leg. Hold that for 10 seconds and back. Or if that's even too tough, you can do it where you're just moving your arms. But again, the end goal is just going all the way out and holding. A way that you can again progress that, if you want to add in just a little bit more dynamic movement of your arms, is going out and you can draw some squares. Again, emphasizing core stability. While extremities are moving, that is the end carryover that we're looking for in our core stability work because it's applicable to the way in which you move in the gym. Stable core, movement of extremities. I have been doing personally the McGill Big 3 before every single workout for the past year, and I've seen crazy carryover into how well and how powerful I'm moving during my workout. On my off days, I still do this. I do a set of 6 for 10 seconds of each exercise. If I don't have a lot of time, if I have time, I do a descending rep scheme pyramid. 6 reps, 4 reps, 2 reps. If you want to do more, 8, 6, 4, 2. But again, the hold is the most important. You must do a 10-second hold to emphasize that stability, to limit the excessive or unwanted motion of the spine moving. We want to keep that spine locked in place while we move the rest of our extremities. But again, the McGill Big 3, I want you to start doing this. I promise you, you will find a huge carryover to how you feel and how you're moving in the gym. Hope you guys liked today's quick video. If you did, please.
Okay, so I hope you would have understood about the abdominal exercises and the core stabilization exercises. We will just see a few more videos and end up the class. So diaphragmatic breathing exercise, most of us will be knowing about it, but just a refreshing video about the respiratory exercises.
Today I'm going to teach you about diaphragmatic breathing. This is a great technique used for relaxation as well as for pain management. Start laying down. You want your knees bent with your feet firmly on the table or on the floor. What you're going to do is you're going to take one hand, you're going to place it on your chest, one hand you're going to place on your stomach. What you're then going to do is take a deep breath in through your nose and exhale out through your mouth. I want you to do that about 3 times. At this point, I want you to think which hand or hands is moving. You should feel that your stomach is moving when you take a deep breath in through your nose. However, if you feel that both hands or just your chest is moving, that means that you are using your neck muscles and other muscles to help with the breathing process versus using your diaphragm. So now what I want you to do is I want you to think about when you take a deep breath in, that you are getting all the air going in through your stomach. So I want you to visualize it as you go. You're taking a deep breath in through your nose. It's coming down past the back of your throat, into your chest, and down into your stomach, and expanding your stomach. At this point, I want you to think about letting that air come out of your stomach, back up into your chest, into the back of your throat, and exhale through your mouth. And it should look like this. Notice again that it's only my stomach moving, not my chest. So once you've mastered the lying down diaphragmatic breathing technique, the next progression is sitting up. Here you have to work against gravity to hold yourself upright. What you want to make sure is that your feet are firmly planted on the floor. Sitting nice and tall, what you're going to do is take one hand, place it on your chest, one hand on your stomach. As you breathe in, again, you should feel your stomach expanding, and as you exhale, your stomach should be deflating. So again, taking 3 deep breaths, I just want you to think which hand or hands is moving. As you can see, only my chest is rising. So again, what we want to do, and I even have people close their eyes to visualize this, you're going to take that deep breath in through your nose, make it all the way down into your belly, make your belly expand, deflate your belly, and exhale through your mouth. And that is diaphragmatic breathing. Now that you know the technique, this is a great thing that you can do when you're at the office, driving in your car, anytime you're in a stressful situation. It'll help relax everything and just get your diaphragm to work a little bit harder in breathing versus your neck muscles.
Next is vented coughing.
Patients with abdominal or thoracic surgeries will find it difficult to cough and to bear down because of the pain of the incision. Patients with abdominal or thoracic surgeries will find it difficult to cough and to bear down because of the pain of the incision. Typical instruction that is used is to support the incisional area with a pillow. They can wrap it around their abdomen as they take in the deep breath and cough. This does a tremendously good job in eliminating pain with the coughing.
So,
Hi, I'm one of the physios from the...
are you able to see this? Okay, so last few videos are for pelvic tilting exercises.
Royal Free NHS Foundation Trust, and today I'm going to be taking you through an exercise called pelvic tilting. Terry, as my patient, will sit on the edge of a comfortable surface, either a bed or a chair, and what she's going to do is slowly curve her spine and roll her pelvis forwards as far as pain will allow, and then she will reverse and tuck her tailbone underneath her and curving her spine the opposite direction. She'll continue to move forwards and backwards for approximately 30 seconds to try and learn what movements her spine is capable of doing. This exercise can also be done in line. So if I get Terry to come and lie down on her back, with her legs bent up in this position, she can then practice arching her back and tucking her bottom underneath her. Fantastic. And again, she's going to roll from position A to position B over the course of 30 seconds. And relax. Good.
One of the best exercises for yoga that you can do when you're pregnant is cat-cow. It can really help with any back pain that you're having. That means sciatic pain, SI pain, even upper back pain it can be helpful for. What it's going to do is allow the baby to drop away from your lower back, giving you a little bit of relief. It's really easy to do. I'll show you how it works here. You'll start in a tabletop position. Your hands right underneath your shoulders, knees right underneath your hips. You'll start with a neutral spine. And then what you're going to want to do is allow the baby to drop down towards the floor. You'll lift your tailbone and look up towards the ceiling. And then you're going to flip the other way, engage the abdominals, lift the baby up, look in towards your stomach, and drop the tailbone. You want to go ahead, exhale as you look up. Perfect. And inhale in. If you take a look at Maggie's spine, she's got a nice C shape in her spine here, and then she flips back the other direction. And keep those going here. Inhale in. And exhale up. A lot of people have back pain or hip pain while they're sleeping. If you wake up in the morning and you're having any of that, you can come to this exercise in bed. You'll inhale looking in and exhale up. Most people say that can help take care of back pain for the rest of the day. Very helpful. Take 2 more just like that here.
Perfect. Pressing up through the
Okay, so
shoulders.
this is in
And
group
exhale up. And one more
44
here.
position. So next in, one more in standing.
Okay, ladies, what we're going to try now is we're going to try and strengthen our postural muscles and pull in our lower back as well to perform some pelvic tilts. I'm going to use a wall today, but you can do it without the wall, but it is better to place yourself against the wall just so you can feel the resistance. So, place your heels, bottom and shoulder blades against the wall. You will find that your shoulder will naturally slouch forward into your natural standing position. So what we need to do is just try and straighten up through our bodies. So head against the wall, shoulder blades pulled back. You'll find that you will arch through the lower back as well. And all I want you to do is just pull your pelvis under to flatten it against the wall. Keep your knees soft and just hold that for a few seconds. Little pause and then just kind of release naturally from it. So it is quite tough just to hold in that position for a few seconds. So we'll perform that again. Soft knees, lower back into the wall. Shoulder blades pressed firmly, head against the wall. Draw your shoulder blades back, squeeze them, and then just tilt your pelvis against the wall. Hold it for a few seconds, keep breathing, and then release. Again, we're going to perform those for 10 to 15 reps as well. Please give those a whirl. Thank you.
Okay. So these are the different pelvic floor exercises in uh, different positions. So I have uploaded almost all the videos in the LMS. You have a look, and if you have any doubt, then we can discuss further. So we have two more topics left, and I think we have 2 more weeks. So one is gynecological surgery, another one is incontinence. So maybe next Tuesday and after that, like both the Tuesdays, I'll be taking 2 hours class so that we are able to complete it. And we will see if we need, we will add one more tutorial class so that we can have a revision of all the practical classes. Is it clear? So that is about from plan from my side. So if you have any doubt, another thing, you just WhatsApp me, then we can clear the doubts. Okay, I'll send you the case scenario maybe in another, like by today. So have a look at it, discuss if possible, then we can have a final discussion in the next class. Is that clear? So if no doubts, then we can wind up the class. Thank you all.